In this video, you will discover the proven way to decrease infection when you have multiple wounds. I will show you the proper way to prepare for your patient, prepare the environment to do your wound care to get the best outcome. We will discuss when to deglove, reglove, sanitize, and or wash, depending on the wound care that you are performing. We'll also go over what is considered clean and what is considered dirty in wound care dressing. Hi, I'm Dr. Kacian Brown. I'm a wound care specialist. I have helped thousands of patients heal their wounds. I have consulted for nurses, ancillary providers, and physicians to help them to achieve the best wound healing for their patients. I've even helped facilities to win awards in wound care excellence. During this segment, feel free to ask any questions, comment below. I will answer your questions. And if there's something on this video that you think someone can benefit from, don't forget to hit that share button. So let's get to the golden nuggets. Let's get to the important pieces of wound care. Is a very special field. It is a special field simply because there is a right and a wrong way to do wound care. The first thing you need to do is know the kind of wound and patient that you're dealing with. As I said before you walk into a room to see a patient, you need to know something about the patient. Something about their history. Is the wound diabetic? Is it venous? Is it a skin tear? Is it a surgical wound? Is it a pressure wound? That helps to determine, it helps you to start thinking, okay, this is what I'm walking into. So you start to prepare for the patient and probably the outcome of the wound care that you're going to be doing. Also, the location of the wound. A wound on a heel is going to need different requirements than a wound on a butt, than a wound on an arm or a forearm. So you need to know the location of where you're going. So many times I see it, you walk into a room blinded. You're not sure about anything about the patient, or you don't know where the wound is. This is not a good way to practice. You want to go in prepared to see your patient so that you could get the best outcome for your wound care. Another thing you need to know is position the patient. Positioning the patient is ultra important, as we discussed earlier. A patient with a wound on the butt, if they're sitting in a wheelchair or in a chair, obviously you're going to have that patient lay down in bed or stand if they can support weight bearing or they can stand up. A patient with a heel wound, that can be very difficult. Sometimes our patients, they can't lift their leg high like a can dancer. So therefore, the best position for viewing the wound or to get the best view is to have the patient laying down on their side. When a patient is on their side, you can see everything on the back, everything on the butt, everything on the posterior thigh, the posterior legs, and the heels. It gives us a good view of what's going on. Positioning the patient is ultra important. Keep in mind, you want to make sure that your patient is comfortable. So what does that mean? If a patient is in pain, that is not going to be a good experience for them. And you, the provider, you're going to be rushed because we don't like having our patients in pain. We don't want that type of environment. So if a patient has to lay on their side, but say they have arthritis in the hip or they can't stay on their side a lot, that would probably be a patient you say, hey, Mr. and Mrs. Jones, go ahead and take some Tylenol or a pain pill, maybe half hour before I come, so that way you'll be able to lay on your side, so that way I can perform the wound care for you. So keeping that patient comfortable is of utmost importance. Be gentle. We talked about this earlier. You have to remember, when a patient has a wound, you have exposed nerve fibers if the wound is open. Even if the wound isn't open, you have diabetic patients or elderly patients who are more sensitive to pain. So pain is a vital sign. You want to pay attention to how much pain your patient is having. Even though when we're caring for a wound or you're cleaning a wound or anything like that, you're putting on a dressing, you're being gentle. Remember, you have exposed. Even your gentlest approach is not gentle enough. Pay attention to your patient in pain. If they're wincing, that's a sign. If they're having pain, then guess what? You need to stop, give them a chance to take a pain pill, or in our practice, we use numbing medication. You need to do your best to make your patient comfortable. You don't want to set up a relationship in that patient's mind to say, okay, oh my, here comes wound care, here comes the pain. That is not going to be a good outcome for them. And if as a provider, it's not going to be a good outcome for you as well. It's going to affect your not only statistics, but the ability for you to be successful in providing wound care for your patient. Setup. This is important. A good wound care provider is an organized wound care provider. So what do I mean by that? If you're in a home or a facility, setup is ultra important. You want to go ahead and get a barrier. You want to get your gauze, your saline, your measuring tape, if you're measuring, your Q-tip, your dressings together. If you're in a facility where you're seeing different patients, like a SNF or a rehab, what we did a lot of times is we would get foil packets or Ziploc bags. So each patient that had a wound had a foil packet, right? And in the foil packet, you had your gauze, your saline, your measuring stick, your Q-tip, the dressings that you're gonna need for each of their wound and their treatments. So you're walking in a facility with a foil packet, everything is ready, you're prepared for that patient. That really comes important, especially when state is surveying the facility or something like that. And it also helps to decrease cross-contamination. The last situation you want to have is where you're running in and out of a room to go run in a closet to go get saline, or, oh wait, I'm out of gauze, let me go into Mrs. Jones's room and borrow some of her gauze. That is a no. So a good wound care provider is a organized wound care provider, and setup is where that organization comes in. Let's talk about washing and sanitizing. This is the most important part of wound care. You have to wash or sanitize your hands before you even put on a glove. I'm not even talking before you touch a patient. Before you don your gloves, you gotta wash or sanitize. There's something about gloves a lot of people don't understand. If your gloves are dirty, gloves are a barrier. They're not 100%. They're not. They're a barrier. So if you look on your glove and there's soiling on your glove, guess what? It's on your hand. That is a situation you want to go ahead and wash. You want to use good old soap and water. You don't want to go for the sanitizer. Think about it. You have a glove and you look, and say the patient has a wound on their bottom, and you look at your glove and there's poop on your glove. Yeah, there's poop on your hand. That glove is not 100%. It is just a barrier. So yeah, you want to go ahead, take that glove off, and you want to go straight to the sink, and you want to use soap, antibacterial soap and water. Then you come back and re-glove. Okay, let's talk about sanitizing or washing your hand before you see that patient. So before you touch a patient, you go ahead, you sanitize, you put on your glove. Then you can go ahead and touch the patient. You can go ahead and take off a dressing. You can go ahead and do whatever it is you need to do. You must be gloved. It is a barrier not only for you, but also it's a barrier to keep your germs from that patient too. And that is ultra important. Remember, we carry germs on our body. So it's not that you're walking around doing it on purpose. It's natural. It's part of being a human. So that glove before you touch a patient is ultra important. So when you touch a patient, say you go and you're trying to take that dressing off that patient. You just sanitize, you put your gloves on, and you're like, okay, let me go ahead and take that glove off. And you're like, all right, let me go ahead and take that dressing off. As soon as you touch that dressing, you're considered dirty. Why? That dressing has been there. It has exudate, it has bacteria, it has wound debris, and God knows what else that is on that dressing. So as soon as you touch that dressing on the patient, your gloves are no longer clean. So what do you need to do? Go ahead, take that dressing off, take your gloves off, throw it in the garbage. Sanitize, re-glove. Then you proceed to cleaning your wound and tending to that patient's wound. You want to approach it where you do one wound at a time. So this specific wound, you go ahead, you took the dressing off, you threw it away with the gloves, you put on your hand sanitizer, you re-glove, you go ahead and you dress that wound. When you are done with that wound, guess what you have to do? Take off your gloves, re-sanitize, Put on new gloves before you go to the other wound. You don't want to be dealing with multiple wounds at one time. That is the greatest way to get infected. That is the greatest way to guarantee cross-contamination. That's not going to be a good outcome for your patient. So you finish this wound, you got new gloves, you re-sanitize, you put it back on, then you'll move on to the next wound. You finish that wound, you take off your gloves, you move on to the next wound. Remember, keep in mind, if at any time you look down on your gloves and soiling, poop, stool, heavy amounts of wound exudate or tissue, or you need to go and wash your hands. Because remember, gloves are not 100%. And this is how you stay away from infection for your patient. With that being said, when it's all said and done, don't forget to wash your hands at the end, because at the end of the day, we carry germs on our hands. And so how we keep the germ count low, sanitize or wash our hands. It is very basic, but is ultra important for wound care in seeing our patient. I hope this content has been to your liking. If there is anything in this video that you think might be beneficial to someone else, don't forget to hit the share button. There's a lot of juicy gold nuggets here that people can benefit from, especially people who do wound care or who are not experts in wound care. You can learn so much, and this can make such a big influence in your patients' lives. Thank you so much for watching my video. Don't forget, pay attention. My next video is going to be on pressure sores, and we're going to talk about everything you need to know about pressure sores, including prevention.